Everybody, this is Jason Profetto. I'm the chair of clinical skills and the director of the OSCE. So this is the orientation for the summer of 2021, the class of 2023, the Integration Foundation. Thank you so much to everyone who has participated and has been recruited as a clinical skills preceptor. I just want to take a quick pause for a moment to make sure that the office door is locked and no one's coming in. Very good. That way you don't get disturbed. Okay, so this is the Integration Foundation Clinical Skills Orientation. On the screen here, you should see a picture of the Clinical Skills Guide. And there has been a tremendous amount of work and shuffling and adapting to what's going to be happening. So I want to make this concise and practical so we don't go into too much detail. And then if anything needs follow-up, we have like a frequently asked questions document that's shared, and you can always ask myself or the administration for any clarity, right? So I just want to move down for a couple of seconds. There's a few details here on like who you're teaching, first year students, some details, the AFMC Clinical Skills National Working Document, which gives you a lot of idea of like where we get our content and standards from, some stuff for the OSCE as well. Just some contributions and editors over the past, and you'll see Dr. Jeffrey McCarthy is one of the main author and editor in conjunction with myself of the guide. Now, when you go down, there's going to be a table of contents, and this is where you actually see the Integration Foundation content. So this is going to be the stuff that's actually the core content that is covered, and it's organized by the weekly session. So there's going to be 12 sessions in total. The next slide is going to have a bit more of a detailed outline in terms of the structure of Integration Foundation. Some of the actual weeks will have pro-comp connections, and these are opportunities, as many people know, within clinical skills to talk about something that has more of a social sciences lens and something that's related to the actual topic of the week. When you move down, this is the bulk, and I think this might be one of the easier ways to visualize the Integration Foundation, right? So Integration Foundation is sort of a blend of three major topics. The first is the host defense and neoplasia. The second is complexity and chronicity. And then the third and last is maternal and child health, age-relating care. So the three will go back to back to back. These are sort of like the three sub-units within the Integration Foundation. And you'll know, part of the goal of Integration Foundation is to incorporate content from prior MFs. And we try to do this in such a way that it's balanced and there's appropriate representation from MFs 1, 2, 3, and 4. So basically, in MFs 1, 2, 3, and 4, everything from like cardiac, respiratory, heme, peripheral vascular, diabetes, endocrine, GI, abdominal, some obs and gynae content, and then MSK, neuro, brain and behavior. It's all been done. And now we're going to be looking at ways of integrating that into a bit more of a complex picture, right? So week 1 is going to be a 45-year-old individual presents to the emergency department with knee pain. So it's going to be a review of some of the musculoskeletal content. And then there's going to be one about someone with a headache or migraine, and that's going to be the subunit for neurology. Melina stool, and that's from MF2, and so on and so forth. And you can get a feel of where these things come from. You're also going to see an integrative component, as I said before, with pro-comp content. The pro-comp content is a deliberate way in which we integrate social sciences into what is generally very heavily oriented clinical skills and scientific academic ways. We try to be inclusive of not necessarily different patient populations, like so for example, HIV or trans individuals or structurally vulnerable populations, but also different areas in medicine, so anesthesia, palliative care, addictions, HIV, care of the elderly, or in telepsychiatry and rural care, for examples, right? If you click on these, it'll send you to the hyperlink to give you a bit more of an idea of what to do from week to week. We are going to be structuring clinical skills as we normally do, in that a tutorial group is assigned a pair of preceptors. The preceptors will be co-residents. They will teach the block, the Integration Foundation together. As much as possible, clinical skills is going to be in person. There's going to be a couple of sessions here, especially towards the end, that are going to be virtual. In the Integration Foundation, there's going to be 3 different schedules where the blocks occur at different times. And this is because we had to split up the actual class due to size and availability in person with all the COVID restrictions. So that's all to say, as a resident co-preceptor, you will be assigned a group. Your group and you will have a schedule in terms of which blocks are happening when. And in between, the students might have times of vacation or electives and be doing other things. The majority of the teaching will be in person. The majority of the teaching will be with standardized patients. So you're going to have a lot of opportunity to do in-person sessions, practicing observation, using standardized patients, and being able to provide a lot of feedback. Now, I just want to show you, a bit of a sense of how do you give feedback? How do evaluations work? What am I expected to know? And that's more for the students, but also for the teachers. So all sort of the standard information is here. We encourage a lot of feedback. There's going to be a mid and end of unit evaluation. There's the AFMC National Clinical Skills document, which sort of gives the standard for all the tests and what students should know at the pre-clerkship and clerkship level. And, even understanding how to use each chapter, right? So using the actual guide, how to use the pro-comp connections. There's a lot of information that's available. So this page here has a lot of information on how to teach. We also have Stethopedia, and Stethopedia is our, actually let me see if I can pull it up here. So Stethopedia this is a McMaster-based resource. And you can see there's a bunch of people that have contributed to this. And there are all sorts of clinical skills that you can actually watch. And it'll be in a video format, right? So it's very cool.
Hemorrhages, as well as any Janeway lesions or Osler nodes.
So just to give you a sense of what that looks like. And there's basically there's videos for each of the cases that we do. How to use a standardized case and how to get all the people involved, and also a little bit of a checklist if you need in terms of what you're looking for. Now, I want to go up here. So if you click on session 1, which is a 45-year-old male, this is session 1 with knee pain. We're going to have the standardized case, which we're going to use. The stem for the case is going to be provided. There's going to be a JAMA article review. Does this patient have septic arthritis? And then there's going to be an opportunity for feedback. And I mean, that's it. It's that simple, right? Everything's here. You're going to have the standardized patient in person. You're going to get all the detail about scheduling and what to do. But the most important thing is to make sure you look at the agenda. The students are going to have a copy of this too. Make sure you know what you're teaching. And the actual JAMA article in this week is going to relate to septic arthritis and looking at some of the evidence around that, right? If you go to session 2, which is the one where there's a headache, and this is also another one where there's a JAMA article review and you're doing a case. I want to go down to one where there's a pro-comp connection. So session 4, where we're looking at lymphadenopathy, right, and different types of bloodborne infection, looking at HIV and getting a bit better of an understanding of stigma around HIV and some of the questions and points to consider. So this is where there's a pro-comp connection, right? And there's also a JAMA article here too. Does this patient have early HIV? And you look at the Rational Clinical Exam series and you get an appreciation of some of the evidence without diving too deep, right? So once you go through this is your schedule week by week, very easy to follow. There's a lot of detail here, especially as it comes to the pro-comp connections, but we wanted to ensure that everyone had the appropriate resources and information available. And as you go down, we sort of come to the end of the sessions where you have the session number 12, the mood disorders in adolescents. And this is going to be the one virtual case. But the others, the others should be in person, right? And then if you go up here, this is where you actually, I believe this is where you get this will bring you back to the actual agenda. And then you can spend some time going through this and getting a better understanding. The guide is pretty heavy though. Like there's quite a bit of detail here and a lot of different things to consider and use. Yeah, but everything is in here, and I'm just gonna go back up to the top. So a couple of quick points. This is going to be running through the summer. There's going to be 12 sessions as we discussed. You're going to have a co-resident preceptor. You're going to be assigned a single group that you're going to follow throughout. The majority of stuff is going to be in-person sessions, except the last one, which is the virtual session. There's going to be a combination of ProComp and JAMA articles to review. There's going to be an actual schedule that you can follow, and there's going to be a guide with all the content. And I think this is, no, is this it here? Is this the, yeah, this is the compiled guide. So this is the one, this is the full guide. Both of these are available on MedPortal, and they'll be sent to you as well. But this is the one where, for example, it has all the details of all the exams, right? So if, for example, you're reviewing the lymph node examination, you got everything here. So, the important stuff on history, the important stuff on physical examination, and so on and so forth, right? So that's that, but this is the one that's specific to the Integration Foundation. There's going to be where's the page here? There's going to be a mid and final evaluation. Feedback is very, very important. Get a good sense from the students in terms of what they need to know, what sort of information they're looking at, what sort of feedback they want, and take feedback yourself in a bit of a debriefing format to understand how to improve and how to optimize the experience of students. And then, there's a lot of information here as we discussed. So I don't want to go through too much of this, and I want to keep this sort of brief and to the point, but just so you can get a better idea of what we're trying to achieve. As with COVID protocols, everything needs to be strictly adhered to. So we're using an institutional setting, which means that we have to listen to all the institutional policies and follow them. So there will be appropriate screening and questionnaires before you go into the actual learning space. And if there's any questions about that, just let us know. But for now, what I'll do is I'll keep it brief. I'm open to questions. You can email me at any time. I'm happy to answer. And again, thank you so much for participating. If you have any questions, do not hesitate to let us know. Thank you and be well. We will talk soon.